So recently, a topic of great concern has been the European Union considering banning finasteride um, because of potential effects on depression and suicidal thoughts. However, I want to take a closer examination of this theory that finasteride causes depression and explain why I don't believe it and present the contradicting evidence. So firstly, let's talk about how it's proposed finasteride causes depression. In the production of a neurosteroid called allopregnanolone, the 5-alpha reductase enzyme is involved in its production and leads to its downstream conversion. However, when you introduce finasteride, it's obviously it's a 5-alpha reductase inhibitor. So many people believe that because of its inhibiting properties, it leads to a like a deprivation of allopregnanolone in humans. However, if we look closely at this, we can see this doesn't actually happen in theory. So the problem with this theory is it doesn't consider that there are different isoenzymes of 5-alpha reductase. Finasteride primarily affects the type 2 5-alpha reductase enzyme and has a negligible effect on the type 1 5-alpha reductase enzyme. Fortunately for us, the type 2 enzyme is found mostly in the scalp and prostate and isn't active in the brain where neurosteroids are synthesized. The other problem with this theory is that finasteride in rodents affects the type 2 and type 1, whereas in humans it doesn't affect the type 1, which is why there are so many rodent studies that show finasteride will alter allopregnanolone levels. However, there are no human studies that I'm aware of that have shown an alteration in allopregnanolone levels in humans. It's important to note that this shouldn't be extrapolated to dutasteride, because dutasteride inhibits all 3 isoenzymes in humans. And by the way, the reason allopregnanolone is believed to be involved in depression is because it's important for promoting stress response and mood regulation, and it does this through binding to the GABA receptors in the brain. So when you deprive the brain of allopregnanolone, it's thought to be a contributing factor to depression. However, as I've just explained, there's no evidence to support that finasteride lowers allopregnanolone levels in humans. Now, it's good and all to look over the mechanistic theory on how finasteride doesn't cause depression, but it's also really important that we actually look at the human data. And because finasteride's been on the market for like nearly 30 years now, so we have plenty of patients that have been treated with it, and it's one of the most prescribed medications in the entire world. So let's do a deep dive into the literature. The first study I want to look at is called The Clinical and Endocrine Effects of Finasteride, a 5-alpha reductase inhibitor in women with idiopathic hirsutism. So this research paper actually pointed out something interesting between the link between finasteride and depression, and it's that people that use finasteride are using it because they have a condition such as androgenic alopecia or benign prostatic hyperplasia, and these conditions themselves may actually cause depression, and finasteride, being a very efficacious drug, by treating it might actually reduce depression amongst those with the conditions, and this is like why I fundamentally disagree with the theory that finasteride causes depression, is because it doesn't consider that hair loss itself may cause depression and anxiety and affect the patient's confidence. So finasteride, it might actually help people's mental health. Obviously, it depends on the person. But just by pointing out some obscure fact, such as 5-alpha reductase being involved in the production of allopregnanolone, I don't think that's very reasonable to just blanket term finasteride and associate it with something. Like, you need to look at it case by case, and really, observe each person's goals, their genetic makeup, all these different things. So yeah, next study I want to look at is it's called the Profile of Men Randomized to the Prostate Cancer Prevention Trial, Baseline Health-Related Quality of Life, Urinary and Sexual Functioning, and Health Behaviors. This study involved 18,882 randomized participants and lasted 7 years, and assessed the quality of life in men taking finasteride, and showed no evidence that finasteride negatively impacted life quality. Even though it doesn't really specifically assess depression and mental health, obviously depression is a huge contributor to your life quality. So, it's important to just acknowledge that this study exists. Next is a study titled Drug or Symptom-Induced Depression in Men Treated with Alpha-1 Blockers for Benign Prostatic Hyperplasia, a nested case control study. Basically, in this study, researchers they looked at the link between the two, but they also acknowledged a problem with a lot of the studies that came after this, that obviously they wouldn't know what studies came after it, but it was basically, they provided a lot of reasoning that I think is important, because it's reasoning that future researchers didn't really consider, and it's the fact that people are taking finasteride because they have a condition such as hair loss or benign prostatic hyperplasia. So just by simply looking at the mental state of people taking finasteride isn't a very good study design, because it doesn't consider the fact that the conditions themselves may actually result in the depression. So it's crucial that you don't look at crude incident rates, and you actually adjust for the presence of androgenetic alopecia or benign prostatic hyperplasia. The next study comes from also 2002, and it's titled Depression Circumstantially Related to the Administration of Finasteride for Androgenetic Alopecia, and it's a review of 23 case reports. The problem with this is, because since these are circumstantial observations, they aren't really high quality scientific evidence, and obviously case reports rank at the bottom of the scientific hierarchy of evidence. So even the researchers themselves acknowledged there needs to be further studies on this link. And obviously, as I mentioned earlier, it's very possible that the feelings of depression may come from having the condition of a hair loss itself. The next study comes from 2006, and it's titled A New Look at the 5-alpha reductase inhibitor finasteride. And this is where I got plenty of valuable insights from, such as the difference between rodent studies and the different isoenzymes of finasteride, and why it likely doesn't alter allopregnanolone and neurosteroid levels. Now, one of the last pieces of evidence I want to point out is a meta-analysis from 2020 titled The Association Between 5-alpha reductase Inhibitor Use and the Risk of Depression, a meta-analysis. And basically the authors conclude dutasteride had a statistically significant association with depression, whereas finasteride didn't. And this fits perfectly with the information I presented earlier about how dutasteride inhibits the type 1 5-alpha reductase enzyme, whereas finasteride does not. So it's possible that dutasteride may lead to a dysregulation between the amount of neurosteroids and their precursors, altering brain signaling and mood regulation. So once again, finasteride is shown to be clear of an association with depression. Now, a lot of you might be wondering why depression, and suicide are listed on the black box of side effects for finasteride. And this is mainly because of, lobbying by the PFS, the Post Finasteride Syndrome Network. They basically put lots of pressure on the FDA, and the FDA ended up, folding to the pressure, despite the fact that they responded to this petition by saying the petition does not provide reasonable evidence of a causal link between finasteride and depression or suicide. The last thing I want to talk about is a meta-analysis from 2024, which also showed no association between 5-alpha reductase inhibitors and depression. And this meta-analysis pooled over 2 million patients. So all in all, I think that the evidence linking finasteride and depression is, it's hardly present in the literature, and there's plenty of high quality evidence that shows there's no association between the two. And there's actually even some evidence that finasteride might improve the mental health of people that have conditions such as hair loss or benign prostatic hyperplasia. So yeah, the main overarching point I want to make is for people not to make these, blanket claims and overarching assumptions about finasteride, because, this drug is extremely efficacious, and if people want to use it, just let them use it. But also on the flip side, like if people have had these, extreme persistent, side effects from finasteride, and it's absolutely destroyed their life quality, like their voice should be heard too. Not that I necessarily, I don't disagree with what they're saying, but I think there needs to be a healthy amount of skepticism. But yeah, sorry, I got a bit sidetracked there, but my main point is that I don't think this drug should be banned because it's been helpful for, hundreds of thousands, probably millions of men, including myself, and almost every person who's in the hair loss community will agree with this, that it's a highly efficacious drug. And although there are some side effects that come along with it, these side effects can also be treated. So this is why I disagree with the mechanism of how finasteride causes depression itself. And even if it did, which it almost certainly doesn't, even if it did, it's up to the user's discretion. Like, it's up to them to decide whether or not they should experience this decline in mental health for the trade-off of reduced hair loss. Like, at the end of the day, almost every drug, there's a trade-off. So it's just ultimately it's up to the user's discretion, and I don't think this drug should just be banned across all these European countries because of some obscure link between finasteride and neurosteroid levels. Anyways, I know this video was a bit, I rambled quite a lot, but there's a lot of things I wanted to talk about, a lot of science I wanted to go over, and I wanted to present my case as best as I could. So thank you for sticking with me, and all the best. I'll see you in the next video.